So we're back with good old Pete on Chapter 5, Healthcare, Shmealthcare. And again, we're not going to be reading this chapter because this chapter is one massive straw man. Now, for the past couple of chapters, we've already discussed the fact that Pete knows nothing about healthcare. He knows nothing about what real doctors do. He doesn't even mention that there are different types of doctors with different types of specialities, and he ignores all this. So in Chapter 5, Healthcare, Shmealthcare, because he knows nothing about healthcare, he has to make a straw man. Now, when his opening statement is this to this chapter: one of the sad facts of allopathic medicine was alluded to in the first chapter is worth taking a longer look at. Here it is. Your MD has absolutely no training, no clinical experience, and no idea whatsoever of how to make you healthy. That is, first of all, that is an absolute lie. They absolutely 100% do. That is what they are trained to do. If you go to a doctor with a problem, they will try and help you solve that problem. You know, and this is again what we've gone for, again, for the past 5 chapters, including the prologue, has all been one big doctor bashing scam and fallacy and lies one after the other. And this chapter is hilarious because he knows, again, as we said to begin with, he knows nothing about healthcare, so he has to come up with a straw man about why essentially your doctor is going to kill you. So he creates this character called Camilla, a 45-year-old African American woman, and it is just insane. Basically, all he's doing continually is basically going through this straw man who he has created, saying that every single step is basically leading to another step that doctors have to do, and that it's genetic, and he says in this, he didn't actually say it in this chapter, but I'm pretty sure he's trying to allude to the fact that if a doctor says that you have a genetic disease or there is something wrong with you in that way, that he is lying to you. That a doctor is lying to you that you have a genetic disease. That is what he's actually trying to get to. And here's another quote from this, again, same chapter. Because Camilla's MD is an allopathic reductionist, it is not his job nor his intention to try and cure the arthritis or the hypertension. As a matter of fact, most MDs have no idea at all of what actually causes diseases. That is, again, an absolute lie. Again, from someone who claims that he had a pre-medical degree, he would have learnt this. He would have learnt this. So again, we're calling into his supposed claim that he has a degree in pre-med, but a pre-med student should be able to destroy him on that statement alone. That is just unbelievable. So again, he basically goes through an entire thing of about how Camilla is lied to by her MD, and she's going to hospital spending all this money when all the problems she had really was a calcium deficiency, and all she really needed to have was take calcium supplements. That's all she needed to do. And instead she goes through all this palaver about, apparently, of having her knee, her hip replaced, and all she needed to do was, oh no, if she'd taken a calcium supplement, she'd be fine. Again, Glidden claims that, you know, he can cure arthritis. He can't cure arthritis. That is an absolute lie. Arthritis by its very nature is incurable because it's your body, an actual part in your body that is basically being ground down, that you are born with, that is basically not replaced. You know, look at tennis players. They're doing so much action with, you know, their elbows that it's actually got a condition named after itself called tennis elbow, where the cartilage has basically been worn away through that much action. And it's just unbelievable, the fact that he makes this claim and science says, no, your claim is wrong, but regardless, he just continues on anyway. So, basically, through this entire chapter, he's, as I've said, made this straw man called Camilla, who basically goes through all this stuff and dies. And this is his, again, opinion on what happens. He has no facts to back it up. He has no experience in any medical field whatsoever. He just blames it on MDs are lying to you. And then they have this wonderful nugget to round off the chapter. The problem with healthcare in the USA is that it is not healthcare. What a wonderful statement. It is MD-directed allopathic reductionist pharmaceutical centrist disease management. That is ridiculous. When sick and scared average Americans do not get to choose between a homeopath, a naturopath, an acupuncturist, or an MD, they get to choose between MDA, MDB, or MDC. It is no real choice at all. Ha! Because again, what has been his crux of this entire book so far, and his entire chapter, is that he is trying to convince you, the reader, and the gullible idiot, who thinks that he is some sort of authority, something that I actually want to pay attention to this. It's not actually on this edition, but in, I think it might be his other book. He actually has a stethoscope around his neck. Now, one of the odd things to note, there's been psychological studies done of when people see people with a stethoscope around their neck, they immediately think that this guy is a doctor and that he has knowledge and that he knows what he's thinking. Curious enough, but a brief side note to that. So again, what can we take away by summing up that chapter? Again, it's pointless. Again, I keep on saying again. God damn it! But it's pointless me reading you that chapter because I've read it myself. It's a complete straw man about why, again, poor Camilla basically dies through bad healthcare, and he just says, "Oh, it's should have taken your calcium supplements. That's what I'd have given her. She'd be cured." And then he goes on to blame, like, you know, doctors saying that, you know, you've got bad genes, are lying to you, and that it's a way for them to make more money, and, you know, that it's lying to you that there is a cure, but they just don't want to give it to you because then, you know, you keep on coming back and giving them more money, and it's just, it is just unbelievable that, again, people think this guy is somehow a genius, and yet I'm only 5 chapters in. And he clearly isn't. He's an idiot who knows nothing about healthcare, so he had to make up a straw man to try and convince you this is what would happen. This is just so insane. I can't believe it. So again, next time, chapter 6, Ship of Fools, where again he's going to go on and basically bash MDs for another couple of pages. Oh boy,